Influenza, flu, in the Unani System of Medicine. In the Unani system, influenza, commonly referred to as Nazla-e-Wabaya, epidemic catarrh, or Huma-e-Wabaya, epidemic fever, is considered an acute respiratory illness caused by an imbalance in the humors, particularly an excess of cold and moist phlegm, balgam, or a disturbance in the body's vital faculties due to external factors like seasonal changes, cold weather, or miasmatic, contaminated air. It is believed to be contagious and spreads through air or close contact, aligning with modern observations of viral transmission. The Unani system identifies influenza through a combination of observable signs and subjective symptoms, which reflect the body's response to humoral imbalance, fever, huma, a rise in body temperature due to excess heat generated by the body's attempt to expel morbid matter, runny nose, zukam, excessive nasal discharge, often watery or thick, indicating an overflow of phlegm, cough, stool, dry or productive cough caused by irritation in the respiratory tract from accumulated phlegm or coldness, sore throat, warmi halk, inflammation or pain in the throat due to humoral disturbance affecting the upper respiratory system, body aches, waja'ul badan, generalized pain or heaviness in the muscles and joints, attributed to the spread of morbid humors. Headache, Suda. Pain in the head resulting from the involvement of the brain's faculties or sinus congestion. Fatigue, Taken. Extreme tiredness or weakness due to the depletion of the body's vital energy, Kuwat. Chills, Barda. Sensation of coldness as the body struggles to regulate its internal heat. These symptoms may vary in intensity depending on the individual's temperament, mizaj, and the dominance of specific humors. In Unani medicine, diagnosis relies heavily on clinical observation and patient history, rather than modern laboratory tests. Practitioners assess the following: pulse examination, NABS. The quality, speed, and rhythm of the pulse help determine the nature of the humoral imbalance, for example, cold and moist or hot and dry. Urine analysis, BAL. The color, consistency, and odor of urine are examined to assess the body's metabolic state and the presence of morbid matter. Tongue and sputum. Observation. The tongue's coating and the nature of sputum, color, thickness, indicate the type of humor involved. Patient history. Questions about exposure to cold, damp environments or sick individuals help identify the cause. While modern diagnostics like viral swabs or blood tests are not part of traditional Unani practice, they may be integrated by contemporary practitioners for confirmation. Unani medicine emphasizes prevention by maintaining humoral balance and strengthening the body's natural defenses, known as tabiat. Recommended precautions include avoiding cold and damp environments, as exposure to cold air or sudden temperature changes can aggravate phlegm production. Maintaining hygiene is crucial. Regular hand washing and avoiding contact with contaminated surfaces reduce the spread of morbid matter. Dietary care is also important. Avoid cold, heavy, or phlegm-producing foods like dairy, raw fruits, or fried items during illness. Isolation is another key measure. Stay away from crowded places or infected individuals to prevent the transmission of miasmatic influences. Lastly, wearing warm clothing helps protect the body from cold breezes, which can disrupt humoral equilibrium. Treatment in the Unani system aims to restore humoral balance, eliminate morbid matter, and strengthen the body's innate healing power. It includes a combination of diet, lifestyle adjustments, and herbal remedies. Dietary management, or Ilaj bil Aghziya, involves consuming warm, light, and easily digestible foods like barley soup, also known as shorba-e-jow, chicken broth, or herbal teas. Avoid cold, raw, or heavy foods that increase phlegm, such as milk, yogurt, or oily dishes. Including warming spices like ginger, cinnamon, and black pepper helps stimulate digestion and expel coldness. Regimental therapy, or Ilaj bil Tadbeer, includes practices like steam inhalation known as bakur, where inhaling steam infused with herbs like eucalyptus or chamomile clears nasal passages and the respiratory tract. Dry cupping, or hijama, is applied to the upper back or chest to remove excess morbid humors and improve circulation. Adequate rest is also emphasized to support the body's natural healing process. Pharmacotherapy, or Ilaj bil dawa, includes herbal decoctions, commonly known as joshanda. This popular remedy is made from herbs like licorice, cinnamon, ginger, and cloves to reduce fever, cough, and congestion. Unani formulations such as Habi Bukar, a tablet used to reduce fever and inflammation, and Sharbat-e-Zofa, a syrup for relieving cough and respiratory distress, are also commonly used. Arki-Gauzaban, a distillate, calms the nervous system and reduces fatigue. Single drugs, including herbs like saffron, myrtle, and black seed, are used for their anti-inflammatory and immune-boosting properties. Lifestyle adjustments are equally important. Keeping the body warm and avoiding overexertion are recommended. Drinking plenty of warm fluids helps thin phlegm and aids its expulsion. The choice of treatment depends on the patient's temperament, the severity of symptoms, and the practitioner's assessment of the dominant humor. This article is intended for educational purposes only, to provide insight into how influenza, or flu, is understood and managed in the Unani system of medicine. It is not a substitute for professional medical advice, diagnosis, or treatment. If you are experiencing symptoms of influenza or are undergoing any treatment, please consult a qualified Unani practitioner or healthcare expert to ensure safe and effective care tailored to your needs.